Hello, everyone, and welcome to the June edition of AOPA's State Policy Forecast. I'm your host, Sam Miller, and today I'll be giving you the most up-to-date information on the current O&P climate. With the help of our members, AOPA tracks and addresses state-level policy challenges across the country. I'll be giving you the scoop on some of those efforts over the next few minutes. To start things off, let's head down to Mississippi, where the state's Medicaid program has seen an update. Effective May 17th, Mississippi Medicaid's fee-for-service vendor now allows for the prior authorization of non-covered orthotic and prosthetic CPT codes when medically necessary for beneficiaries over the age of 21 in special circumstances. We've confirmed that providers in the state have successfully received prior authorization and payment from Medicaid to provide these services. This is a developing story, and we'll be sure to update you all as the situation changes. Next, we'll travel to New York for a couple of key legislative updates. Senate Bill 3131, which directs the Commissioner of Health to conduct a study related to New York Medicaid's rate adequacy and patient access, has successfully passed both chambers of the legislature and is now on Governor Kathy Hochul's desk, due to efforts from AOPA and advocates led by Matt Johnson. The New York legislature has also introduced Assembly Bill 7793, also known as Carter's Law, which mandates health insurance coverage for treatment of congenital conditions, including certain reconstructive services, habilitative services, and inpatient and outpatient services. You hear that, folks? That's the So Kids Can Move groove once again. Let's move west to Colorado for some exciting news. House Bill 1136, which requires state commercial plans to cover activity-specific prostheses for enrollees of all ages, has been signed into law by Governor Jared Polis, thanks in part to continued efforts from the Rocky Mountain O&P Coalition. The bill will take effect for plans issued or renewed in 2025. Next, we'll move north to Minnesota to learn more about a recently introduced bill. Companion bills HF 3339 and SF 3351, introduced with the help of AOPA President Terry Kuffel and the Minnesota Society of Orthotists, Prosthetists, and Pedorthists, implement insurance fairness in the state and require coverage of both activity-specific devices and devices for showering and bathing. Finally, we'll head to New Jersey for another new piece of legislation. Senate Bill 3919, which mandates coverage of activity-specific devices for enrollees of all ages in state commercial and public employee plans, was recently introduced into the New Jersey legislature with the support of Steve Slavinsky. Reimbursement for these devices would be set at the Medicare fee schedule. All right, folks, that just about wraps things up for the states. But I do have some exciting federal news to share. Last week, the Medicare O&P Patient-Centered Care Act was introduced in Congress. Numbered H.R. 4315, the bill will ensure timely access to quality O&P care while preventing fraud in the Medicare system. If you'd like to show support for the bill, you can find the link to our letter writing campaign on the AOPA website. And as always, for more state O&P policy info, please be sure to check out the AOPA Co-op and the state-by-state section of the O&P Almanac. This is Sam Miller, signing off.